Hello. Good afternoon. I am Dr. Festus Asad, a medical practitioner, a sonologist, and also an ultrasound scan training expert. You're welcome. I, on behalf of my partners and staff of Exploit Diagnostics and Clinical Services, welcome you all to this presentation. We had a board meeting the other day and we decided that we have some free training sessions over the net so that people all over the world can benefit, especially using this Facebook as one of the medium to reach out to people. So you're welcome. We're going to have a series of training sections in obstetric gynecological scan, including an abdominal scan. But today, I want us to look at something very, very critical and essential in ultrasound scan, what I call insurance policy. Insurance policy. Insurance is an acronym for certain words or explanations which I'm going to go through. But before I do this, you know that normally when we conduct an ultrasound scan, we end up doing some certain things. One, we end up writing, of course, you will conduct a scan, you get your findings down, you write your reports, and the next thing is to sign or rather append your signature in that report. In chapter 13 of my book, the book I wrote, sorry, don't bother about the size, it's just it's quite easy to read and understand. In chapter 13, talking about writing of ultrasound reports, I did discuss extensively on what it means to write an ultrasound report. Sometimes you may conduct a very good ultrasound scan, but the way and manner you write your reports really matters. And talking about this insurance policy here, like I tell people, after you must have done your scan, you got your findings, write your report, the next thing you do or the final thing you do is to append your signature. But before you do that, I want you to take note of this insurance policy. Very, very important. Now, I remember usually whenever I go for training sections or presentations in different organizations or in different parts of the country, I normally mention some things to them that I want you to ponder upon, and it's very, very important. One of them is this. I always tell them that, one, the knowledge of medical ultrasonography is infinite and dynamic. And also, the skills and techniques are highly apprenticeship acquired. So you have to be trained through the apprenticeship program for you to get some certain skills that you need to know in ultrasound scan. So these things are very, very important. You should put that at the back of your mind. Now, the consistent accuracy of ultrasound reports is highly operator dependent. Whatever report you are getting depends on who is operating the machine, who is conducting the scan. It's very, very important. And also it falls under what we call the three principle, the scan, see, and report principle. It is what you scan, you see, and that's what you're going to report. Then finally, we know that the words sonographers and sonologists are used interchangeably, but by different organizations. But I want us to take note of this. While it takes a good anatomist to be a good sonographer, it rather takes a good sonologist, a good clinician, to be a good sonologist. Because a sonologist is essentially a medical doctor that applies his clinical skills to make interpretation of what ultrasound reports. These things are essentially important. Because for the fact that you're a medical doctor does not give you an automatic cover or a blanket for you to be a good sonologist. Your clinical knowledge is equally important. Now, back to business. We're talking about insurance policy here. Insurance policy. Before you append your signature, you must have a look at this and ask yourself these questions. And if these questions you ask yourself are all answered as yes, 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 then you are good as go to conduct your scan, append your signature, and the rest is history. Now, what does the I stand for? The I stands for idea. Of course, before you conduct a scan, you must have an idea of the kind of scan you're conducting. You may be good in a gynecological scan, but you may not be good in obstetric scan, or rather in thyroid scan or breast scan and the rest. So any scan you're conducting, you must have a good idea of what you want to do. If not, refer to the next person or call for a second or a better second opinion. Now, good, you must have a good idea. And if you have a good idea, you make sure that your results are not manipulated or doctored. Some people have the idea of doctoring their report so it will suit whoever is sending the patient to them. Once you write a request form, query appendicitis, the next thing they just reply back to you, an appendicitis, diagnosis of appendicitis. And that's just one of the examples anyway. And I can see that's why you see some doctors when they send patients for scan, they don't like putting clinical information. Because they believe that the clinical information normally bias the mind or whoever is conducting the scan, although that's not supposed to be. So a lot of people, in the essence of trying to create a diagnosis, just want to make sure the clinical information gets into them and it affects their result. And also, apart from the fact that the clinical information given by the referring doctors can mislead you if you don't know what you're doing, the patient as well can mislead you. So a patient can come and say, I'm 4 months pregnant. And she's very sure, telling you that, look, I feel the fetal movement, all sort of things. But you're conducting the scan, you're not seeing the baby. What do? Do you write the woman is pregnant? No. Don't doctor your reports. Your report must be as you've seen it. You report it accurately and exactly. Now, your report you're writing, if it's not doctored or manipulated, is it sensible to you? Does it make sense to you first? If your report does not make sense to you, then it should not make sense to the next person. It must make sense to you. And it's very, very important. But I'm straight to the point. Don't try dabbling things. Like there was a case I saw the other day. A lady was trying to write in a report. I don't want to mention names. She wrote that the woman did an abdominal scan and said flatus was discovered in the abdomen. I laughed. Flatus? Well, I don't know, but that's quite, flatus is quite, it's not an ultrasound a kind of terminology or even a radiological terminology, because you have to use the right terminologies at every point in time for your result to what makes sense. Your terminologies must correlate with whatever you are doing. And don't try to impress by putting a lot of medical jargons in your report. It may end up messing up the whole thing. So now, when it's sensible and straight to the point, then if it's sensible and straight to the point, it must be understandable. If you conduct an ultrasound scan that nobody understands, it's useless. Because, good, if you are the one that is scanning and interpreting and taking the patient and managing the patient, it's a different ballgame entirely. But people may send patients to you for scanning, and they need to understand your report. So if your reports are not understandable, then there's a problem along the line. So they must be what understandable. Use as the simple language as much as possible to get these things done. It's very, very important. Now, if your results are understandable, of course they should be reliable and reproducible. A reliable ultrasound report is the best report. So people talk about side effects of ultrasound scan. Like I tell people, the greatest side effect of ultrasound scan is wrong ultrasound reports. So ultrasound reports have sent some people to theater where they don't need surgery. So wrong ultrasound report has ended up causing a iatrogenic abortion. So the doctors go and say they conduct a supposedly evacuation. It turns out to be an abortion because somebody conducted the scan and said there was a blighted ovum, there's no fetal bone, and of course the doctor what you need to do an evacuation. So a lot of them, somebody will say the woman has an ectopic pregnancy, maybe saw a corpus luteum and thought it's an ectopic pregnancy because the woman has a pain, and the doctor comes and maybe for some certain reasons and just take the person to the theater, and before you open up you don't see anything. So a lot of things happen like that. Like some cases of people you see a corpus luteum, you think it's a complex ovarian mass. And of course, the man comes with pain. You operate and say, okay, you want to take for histology. You take the histology and comes by it's what a corpus there. Little can be that embarrassing. So you must make sure your results are what reliable. And if they are reliable, it should be reproducible. Anywhere in the world, if you conduct a scan, let it be the way it is. East, west, north, south, let it be the way it is. It must be what reproducible. A twin pregnancy in Nigeria should be a twin pregnancy in Ghana, should be a twin pregnancy in New York, in the UK, United Kingdom, anywhere else, it must be what? A twin pregnancy. It must be reproducible. So that's why it is very, very important. Like there was a time and you know, if your results are reliable and reproducible, of course, you will be what? Self-confident because you know what you're doing. Don't ever be intimidated. Like I always tell my students, don't be intimidated by whoever comes to you, wherever your result comes from. Like some years ago, I was in a clinic in Akwa Ibom, in Akwa Ibom State, and I was in the training section for doctors. So the patient, they brought a patient that traveled abroad, and they did a scan for her, and they said she had a complex ovarian mass. So they came in, of course, for surgery and the rest when they came back to Nigeria. So the doctor said, let's have a look at it. Well, I said, well, come to the ovarian mass. Well, let me have my own personal opinion about it. When I conducted the scan, I discovered it was not a complex ovarian mass, but rather a fibroid or rather a leiomyoma that was undergoing what degenerative change. So I didn't bother whether it was. I don't care. Like if I'm doing a scan, I don't care where the result is going to. I don't care whatever one are coming from. I just do what I know and leave it that way. Don't try to impress. Write what you see, and you must have what is self-confident. And the more you know in ultrasound scan, the more self-confident you become. So your result will be what reliable and what reproducible. Now, talk about acceptability. The results should be acceptable. anywhere in the world. It should be acceptable. I know sometimes some people in the government setting believe that those in private setting, I don't know what they do, but give your report as accurate as possible. They will come to you and they'll make a reference. There was a case I saw, that was about 2 years ago. A woman came, she had been managed, she was managed for a case of multiple fibroids for quite some time, but she was going down, losing weight and the rest. They did a scan in one of the non-teaching hospitals and said the woman had multiple fibroids. So I don't know, for 1 or 2 reasons she came to me, somebody sent her to me. When I did the scan, I noticed it was a case of cancer of the cervix. Of course, there was fibroid, there was myoma alongside. It was a case of cancer of the cervix. And I stated my findings accurately, and I sent it back. Of course, the main diagnosis of cancer of the cervix is for what? Histology. But it gave them the guideline. I queried it. I said, query cancer of CA cervix. When she got back to the hospital, they looked at the results. Initially, they didn't want to accept it because they felt it came from a private setting. While the doctor, the consultant, started going through the report, that started making sense to him. Talking about what? Sensible. Started making sense to him. And he said, no, let's fire this one and work based on what I'm seeing here. The woman came back at 3 weeks afterwards and after started telling me the whole story of what happened. And she was looking far better. That had changed the level of management for that patient. It's very, very important. So your results should be acceptable. And of course, if your results are acceptable, it should be noteworthy. And also, what I want you to know about, talk about the clinical correlation of your ultrasound report. Ultrasound reports are not done in isolation. Are you getting it? They should not be done in isolation. If a woman comes, and that's why this clinical correlation gives doctors more edge over paramedics when it comes to making diagnosis in ultrasound scan. Because as a doctor, you can differentiate between hematometron and retained product of conception, because the findings is essentially the same in ultrasound scan. As a medical practitioner, as a doctor, you should know the difference between missed abortion, inevitable abortion, threatened abortion. Because when you're using this terminology, you are using it because you work a medical practitioner, you know what exactly they are. So the clinical correlation is very, very important. The history and the clinical findings and also the ultrasound findings tie up the whole thing together and make a much better report. Now, experience and expertise. You should be well experienced in what you do in ultrasound scan. And the more you do the right thing in ultrasound scan, the more confident you become and the more experience you claim at the end of the day. Talk about your expertise. Like I tell people, if you're not trained in ultrasound scan, even if you spend 20 years, you may not be doing the right thing, or you're doing it with difficulty. That is why you need that basic training in ultrasound scan, so that over the years you improve in what you do. Like I tell people, this book I wrote, if not for the fact that I was trained in ultrasound scan, I don't think I would be able to put this piece together. But I give all the glory to God, because most of the wisdom comes from inspiration. When I wrote this book, it's almost 400-page book in obstetric ultrasonography. See, from the experience and research, I was able to put this book together. So it took me about almost 4 years to write, but I thank God for everything. So I've seen people having like 10, 15 years or 20 years in ultrasound scan, but they are still having some certain challenges. But once you are trained, it makes it easy for you to grow from one level to another. I've seen people going to Ghana. I had about 2 or 3 people I trained that went to India for ultrasound training. They came back, they were having challenges. They brought them to me and I put them through, and they are doing well by the grace of God. So that's about the experience. It's quite important. So, like what you can see, for you to append your signature in your report, you must have what insurance policy. And if all these things is yes to you, that means you are confident enough to put your signature and your report. That is to say, you have an idea of what you are doing, your results are well stated and the way you saw them, not a manipulated or doctor. Your results are sensible and straight to the point. Your results are understandable. They are equally reliable and reproducible. And of course, the results are acceptable, noteworthy, and with good and strong clinical correlation. Of course, your experience is part of the whole game that comes into play before you append your signature. With all this, you're home and dry. And like I tell people, don't force out things. The little you know and know better is better than you knowing so much and you don't know anything. Let's try and put things together and be very well read, very well placed in whatever you want to do. Like I tell people, some people say, Dr. Sir, how come you talk with so much confidence? The one I know it. The one I don't know, I don't know it. And that's the simple as possible. That's as simple as ABC. And the people I train, make sure we train them from the basics, so that anywhere you go in the world, you can shine, and shine very well. So thank you for listening. Hope I've not bored you so much. Don't talk about insurance policy. We will talk about other aspects of training alongside. But take note, this is very, very important. If you don't have insurance policy, don't sign that report. Thanks for listening. Remain blessed.